Minimally invasive hysterectomy. What happens on the day of your surgery? In this video, you will learn what happens on the day of your surgery, how to care for yourself while you are still in the hospital. What happens on the day of your surgery? If you were told you need to take your medicines on the morning of surgery, take them at home with a sip of water. When to arrive at the hospital. You must come to the surgical admissions unit 2 hours before your surgery is scheduled. Your surgeon's office will confirm the day and time with you a few days before your surgery. The surgical admission clinic is on the second floor of the Peter Monk building at Toronto General Hospital. What to expect when you arrive at the surgical unit. When you arrive, the nurses will help you get ready for surgery. A nurse will check your blood pressure, pulse, temperature, and breathing rate. After the nurse has checked you, you will change into a hospital gown. A nurse will put an intravenous IV in a vein in your arm. The IV is used to give you fluids and medicines during and after surgery. As your healthcare team prepares you for surgery, they will check your hospital identification band and ask the same questions many times, such as your name, date of birth, and the type of surgery you are having. The team asks you these questions to ensure your safety and make sure you are getting the correct treatment. After surgery, you will go to the post-anesthetic care unit. This is the recovery room where the nurses will care for you until you wake up. When you wake up, you may have a catheter in place. A catheter is a thin tube put in your bladder to drain pee. The nurse will remove the catheter. You will usually stay in PACU for 1 to 2 hours. Once you are awake and stable, you will go to a short stay unit until you are ready to go home. At the short stay unit, nurses will check your vital signs like blood pressure and pulse, your incisions or surgical cuts, and check for vaginal bleeding to ensure that there are no problems. Give you medicine to relieve your pain, remove your IV when you are drinking well, help you sit up and get out of bed, take you to the bathroom and measure your pee to make sure your bladder is working well, and give you something to drink and eat. How to care for yourself while you are still in the hospital. Here are a few things you can do to care for yourself while you are still in the hospital. 1. Do the deep breathing and coughing exercises your nurse showed you during your pre-admission visit. These exercises help expand your lungs after surgery. 2. Do the leg exercises you were shown. These exercises increase blood flow to your legs and prevent blood clots. 3. Walk around the unit. Moving early and often helps you recover by opening up your lungs, increasing blood flow to your legs, and preventing infections. 4. Have a pee and empty your bladder as much as you can. If you have trouble peeing, tell your nurse. If you cannot pee after a few tries, your nurse may put a catheter back into your bladder. You may go home with a catheter in place and have it removed in the clinic in a few days. For more information on your recovery and other questions you may have, read the pamphlet about preparing for your surgery and recovery at home. Your healthcare provider will review with you the discharge instructions. These include going over symptoms to watch for. You may need to return to the hospital if you have these symptoms. Provide you with a follow-up appointment date. Review your discharge prescriptions with you. You will go home the same day as your surgery if your healthcare team feels you are doing well. Make sure you arrange for someone to take you home. Someone must stay at home with you on the first night you return home from surgery, in case of an emergency. If you need to stay overnight in the hospital for medical reasons, arrange for someone to pick you up at 8 a.m. the following morning. In this video, you have learned what happens on the day of your surgery, how to care for yourself while you are still in the hospital. Watch the next video to learn about how to take care of yourself at home.